As a world trend that we are moving towards the endovascular-first method. Hi everyone, I'm Dr. Ismazizi from National Heart Institute, Kuala Lumpur, Malaysia. This is my first experience will be in the Paris Vascular Insight course. It's a very excellent event with all the world-renowned vascular surgeons who are sharing their experience in this event. So I'm very fortunate that I get invited by the organizing event led by the Dr. Jan Gefik, Stefan Hulon, and also Dr. Condilus to share the experience in my center regarding the acute limb ischemia. So as we know, the vascular for the acute limb ischemia, one of the second commonest vascular emergency in my country, and then majority was treated with the conventional surgery. But as a world trend that we are moving towards the endovascular-first method, that would like to share my center experience with the audience, especially people from the Europe regarding our my center experience in treating this kind of condition. And from the experience that I would say that the result was encouraging, and then we managed to get good clot clearance, and we managed to able to salvage a leg a patient with this kind of issue even without need to converting to the conventional open surgery. And majority of patients was get the early discharge from the hospital, good symptomatic recovery, and angiographically we can see good flow in the previously occluded vessel. Definitely, I looking forward more clinical trial and also more concrete evidence to look into endovascular first method in dealing with the acute limb ischemia in my region, and definitely looking into the Europe and also US experience. Thank you, everyone.